Welcome to lesson number 3. In the last lesson, we went over linear regression, a very popular supervised form of machine learning. Now we'll cover another form of supervised learning which we'll encounter all throughout this course, and that is classification, a very important concept in self-driving cars. Classification predictive modeling approximates a mapping function which predicts the class or category for a given observation. In the most simple terms, it takes some kind of input X and classifies it, maps it to some category. Generally, based on previous data sets, it would calculate the likelihood of something belonging to some class. The best way to get a broad sense of how classification works is to go through an example. Say we're a hospital which annually tests thousands of patients. It's our job, based on that person's condition, to determine whether or not they are likely to become diabetic. Let's suppose the examination contains information regarding two attributes, the person's blood sugar and their age. Generally speaking, high blood sugar normally indicates a resistance to insulin. Without insulin, a lot of sugar builds up in the bloodstream, leading to diabetes. As far as age goes, as someone gets older, generally speaking, they tend to exercise less, gain weight, increasing the risk of diabetes as well. Obviously, in diagnosis, a lot of other factors are considered like blood pressure, cholesterol levels, family history, etc. But for the sake of our model, and keeping things simple, we'll assume that the higher your blood sugar and the older you are, the more likely you are to become diabetic. Suppose one person has blood sugar levels of 2 millimoles per liter and is 20 years old. This person is young and their blood sugar levels are relatively low, and thus unlikely that they would be diabetic. They're in good health. Another person is 60 years old with blood sugar levels of 11 millimoles per liter. Obviously, this person is relatively older with a very high blood sugar. So we'll assume it's very likely that they are diabetic. Finally, there is another person who's 45 years old with blood sugar levels of 5 millimoles per liter. Is this person likely to have the disease or not likely? This one's a bit of a question mark. We need some kind of predictive model which can predict the category, the class to which a person belongs in, based on this given input. The categories being, is that person likely to have the disease or not? We'll start by representing this predictive model inside of a two-dimensional Cartesian coordinate system. Blood glucose levels will traverse the vertical axis, which will range from 0 to 12 millimoles per liter, and age will traverse the horizontal axis, in our case simply ranging from 0 to 100 years. What we'll do now is plot the people we have so far. The first one will be plotted on the coordinates that denote 2 millimoles per liter of sugar and 20 years old, located in the bottom left of our coordinate space. The second person will be plotted on the coordinates denoting 11 millimoles per liter and 60 years old. Let's assume that we ended up testing both of our patients and actually found out that this person indeed did have diabetes and this person did not. Thus, we can assign each one a label, such that this applicant has the disease and this one does not. We'll denote not being diabetic as blue and actually having the disease as red. How does this determine whether or not the person who's 45 years old with 5 millimoles per liter of glucose level have diabetes or not? To which class do we classify this person? Is he likely to have the disease or not? Well, recall that since classification is a supervised form of learning, we need previously labeled datasets so that we can develop a model which is going to learn how to calculate the likelihood of a new patient belonging to some class. What you're seeing now, all of these points are actually patients who we ended up testing. We found out which ones were diabetic and which ones weren't. Anyone that didn't have it was labeled as blue, and anyone that did carry the disease is labeled red. Clearly there's a pattern in our data. The higher your age and blood sugar, the more likely you are to become diabetic. What about this person who's 45 years old, with sugar levels of 5 millimoles per liter? This person, unlike the others, we haven't actually tested them. They have not been labeled, but based on previous data, it can be confidently predicted that no, this person is not likely to have the disease. You can easily look and see that previous patients with similar blood sugar and age, whom we actually tested, are not diabetic. Thus, we can conclude that this person is likely not to be diabetic either. Now recall, we previously discussed how we can use lines to classify data among discrete classes. Well, simply enough, our data can be separated by a line. This line is represented by some linear equation. How do we obtain the equation of this line? Well, that's a much longer discussion that we'll leave for later. But essentially, there is a clear distinction that patients above the line are diabetic and patients below the line are not. That being said, based on this line, based on our predictive model, which was obtained thanks to previous data sets, we can effectively predict the probability of a new patient having diabetes. If, for example, someone has blood sugar levels of 4 millimoles per liter and is 55 years old, this is a new data set, and it's not labeled. We haven't actually tested this person, so we don't know. We need to use our linear model, which we obtained from previously labeled data sets, to make a prediction. Clearly, this coordinate is plotted below the line. It can then be confidently assumed that this person is not likely to be diabetic. In summary, what we're doing is first looking at previous data sets of patients who have already been labeled as having the disease or not, and based on that data, we can come up with a pattern, a predictive linear model, a line that best separates our data into discrete classes. Classification, in itself, is a very important concept in self-driving cars. Implementing an algorithm that's able to find this line with minimal error will be the entire focus of this section. Solving classification problems is essential in self-driving cars and can be used to classify whether an object crossing the road is a car, a pedestrian, a bicycle, or even identifying different traffic signs.